Okay, so my final question now. So let's say a panel of experts in the condition or in the disease, with also experts in methodology, evaluated the evidence and judged its quality or their confidence in the estimates, and considered all these factors you described, like values and preferences and cost and the balance between trade-offs, and now they want to issue a recommendation. So what are the implications of a strong versus a conditional or weak recommendation? What should they consider?
Mm-hmm. I think that the guiding principle for task forces is that a strong recommendation is an invitation for quality improvement and performance measurement organizations. It's an invitation for them to consider this recommendation as driving the development of a metric for performance. In other words, clinicians should be held accountable to strong recommendations. If a task force issues strong recommendations, they should be ready to see their colleagues being held accountable to following that recommendation, because again, this panel of experts will be expressing a high degree of confidence that if patients were to receive the recommended treatment, that the patients will be better off. So that constitutes almost the perfect situation for quality metrics to take place. A conditional or weak recommendation should probably not be used for quality of performance measurement. It should be an invitation for a more deliberative approach, perhaps one, as I mentioned before, that invites shared decision-making between patients and clinicians. In that case, the quality parameter could be one in which you perform or you conduct a shared decision-making process with the patient, and you may be held accountable to having those conversations. But certainly would not be an appropriate use of quality metrics to use it with weak recommendations. In most areas of medicine, there will be very few strong recommendations, and the majority of the recommendations will be conditional. The way panels are helpful to clinicians in the context of conditional recommendations is by clearly identifying what conditions moderate or modulate the direction of the recommendation. It is widely considered unsuccessful for guideline panels to say that clinician judgment should be used and not specify the factors that should be considered in making that judgment. It's a paradox in guideline development that where we feel that we can make the best case for a strong recommendation is also the case in which the recommendation may be least helpful. That is, when the evidence is clear and the course of action that should be taken is also clear to everyone. The situation where we think guidelines from experts will be most helpful is in the situation where the evidence doesn't help that much, and what is the right thing to do is difficult to discern. In that situation, what makes the expert task forces particularly helpful, again, is to indicate a general direction towards action or no action, and also identify the factors that should affect that particular judgment.
Thank you very much. That was Dr. Victor Montori from the Knowledge and Evaluation Unit at the Mayo Clinic. Thank you.